are joined by Adar Poonawalla, the man who a lot of us in India are watching because his company, his group is the one which is tied up with the Oxford vaccine for production here in India. Adar Poonawalla, thank you so much for speaking with us. Vaccines have been so much in the news. It's something really that all of us feel, we're all just tracking it very, very closely. I just want to start off by asking you the question, which, it never gets old really. As someone who is tracking that as a business proposition as well, I believe, I was speaking with someone, and I believe that while Oxford trials are at their third and very final stages, but even before they clear it and the vaccine gets complete clearance, you will begin production, and that could be as soon as next month. Is that correct?
Yes, we have to start manufacturing some of these candidates at risk because if the world wants hundreds of millions of doses by the end of the year, we need to start by August, September. And we've planned that. We are planning to start manufacturing the batches when we apply for phase 3 clinical trial permissions, which should be in the first week of August. And that's when we'll start the production. So that's the plan. And look, of course, there's risk taking in everything. And this is where we have chosen to put in a lot of our investment, both in the OPEX and the CAPEX, so that we can have a dedicated facility, so that we can, procure all the raw materials, the glass vials, the chemicals, which we've already done. And that's the risk that if it doesn't work out, then, we've got to go on to the next candidate and the next candidate and so on. So we've got 5 different partnerships at the moment, including 2 of them being our own candidates. So I'm sure something will eventually work. But, we shouldn't be in a rush. We should take our time and make sure that the vaccine that we launch is safe and efficacious.
It's interesting you referred to not taking a rush. I have a question about that. But before that, because what you're saying is very, very exciting, can you explain the timeline a bit more? Because, the last kind of news update that we had coming in from Oxford was the fact that they had started the human trials in places which were pretty badly hit right now, which is Brazil. And they had also started in South Africa. So what does that mean? That as because it looks like it, people are saying that the chances of it working out are very, very high. That's why what you're doing is you are looking at getting, you're taking a chance on that. And how many will you start bringing? And that means by when will you be ready to cater to the billion population here in India?
No, so as I said, rolling out the vaccine, reaching everyone in India is probably going to take more than a year, even from December. So we're talking about a year and a half from today, at least, because we're talking about reaching parts of the country that, are very difficult to reach. And not only that, even if we assume that, people will come in from the rural parts, to the main cities to get vaccinated. I don't know how that whole plan is going to pan out, but it will take at least a year and a half to 2 years from today before everyone in India gets the vaccine. And that's provided the vaccine trials succeed and work. So that's the main if. I think after that, we could probably try and calculate or work out how much time it will take. But look, the way the disease is spreading, 70-80% are asymptomatic, which means you're not really having very detrimental symptoms, or the severity of the disease is not so bad in most healthy individuals. It is very infectious, and a lot of people are going to start getting the disease way before the vaccine comes about. I think in the US, roughly, I think almost 1% of the US has already got the disease. What are the latest figures? I don't know, maybe tens of millions or of people who've got it in the US. And if you take a population of just over 300 million, you're close to 1% of the US population also getting it. And that's visible because of the amount of testing they're doing. And I've said if you increase the testing, which people are gearing up in India, you'll see something similar coming about where 2-3% of the population probably by the end of this year will have it. And in 3 to 4 years, maybe 20-30% of the population will have got the disease and recovered or have been infected. So we'll have to wait and see.
So, Mr. Poonawalla, I know that you've spoken about this, that, that we are not testing enough. People should be tested more. Right now, we've just celebrated and marked, the Indian government has released the figure of saying that we've done 1 crore tests. That's 10 million tests. You don't think, you're not satisfied by that?
No, I think that's a joke. I think it should be at least 100 million, because if you look at our population, and you look at other countries and the amount of testing they've done, it's way more. And um, I think as the labs are gearing up, being trained, we've also launched this machine from My Labs, which is a company I own a stake in, the other day, where it can perform 400 tests a day with one person or two people, just trained people. So I think we certainly have the technology and capability in India to do it. We just have to do it. And I believe in Mumbai recently there was an announcement that now you no longer need a
Yes.
doctor's certificate to get tested. If it's a corporate or an individual who wants to test for their own safety, in a workplace, let's say you've got a couple of hundred employees or 1,000 employees, you want to be able to test everyone so that you feel safe and they feel safe coming back to work.
Basically, anyone who wants to get tested should have the
I
capacity or
mean, why,
ability.
why would restrict? Yeah, there's no logic to restrict that. I mean, initially there was a logic that, you'd run out of tests and you wouldn't have enough tests for the people who need to be tested. But now that's no longer the case. My Labs itself can produce 2 million kits per week, 2 million, you know, and there are many other good companies in India as well. So testing kits is not the issue. I think the bottleneck was a little bit at the labs, the private labs, the government labs needed, the training and the space to do it. But even that's now gearing up. So
Now and then you do hear apprehensions of the fact that people are just not testing enough, and this is true of certain states, because they are scared of what the numbers will mean about, or will say about, the way the state is being run, or how the corona management is done by the particular authorities in that state. Do you think that's true?
see, I think initially that was true, but very soon now, whether it's at a country level or a state level, where they compare other countries or other states to the number of cases that they're showing off or not showing, I don't think anybody's going to care, because there's going to be no shame in a state or a country which has got these cases, because this is something out of anyone's control. You can't control it, you can't stop it. You can mitigate, you can take measures, everyone's taking their precautions, they're wearing their masks, social distancing and all, but you can't hold it back beyond a point. So there's no shame. So I think as soon as countries realize that and the individual states realize that there's no competition and shame.
Recently, the ICMR's letter created a major controversy. Why do you think, and what do you think that entire episode shows about the kind of concerns and the priorities right now?
I think the letter was misconstrued. I think they were just trying to expedite things which the government is expected to do, and they're doing a fabulous job about it. You've got Bharat Biotech, which is an excellent R&D company, and they've also made statements of how they are going to do phase 1, 2, and 3, and make their vaccine. I think it was all misconstrued and sort of jumbled up, where people understood it in the wrong way. Nobody is trying to cut corners. The whole vaccine industry and the IVMA that I chair, I'm the president of, we're all standing together to say that we will all conduct phase 1, 2, and 3 trials. And even the ICMR wants us to do that. They also want to adhere to the highest global standards which they've made public. They always have. They're a very highly respected institution. I think they just wanted to expedite things, and it was misconstrued in a way. It was just that they said they hope that they can, get a vaccine out very fast. I think everybody has now learned not to make any such statements. We have to all be calm and patient, wait for the science and the trials to dictate to us what we should be doing next.
Adar Poonawalla, thank you so much for speaking with Hindustan Times, and good luck with ramping up production, and good luck with the vaccine. Hopefully, it all works out. Thanks so much.
Thank you very much.